Have you been told about the GLP-1 drugs like Ozempic, Wegovy, Ojaro, or Zepbound? They're being held as the miracle cure for weight loss, but what the ads don't tell you is that these drugs come with a heavy price, financially and physically. And just to make sure you have options, I'm here to share natural alternatives that can help you lose weight safely and effectively without the long list of dangerous side effects. So if that resonates with you, please share this video with anyone you know who's considering these drugs or are already using them. This information will give them an opportunity to better justify whether they should be using these drugs. So why does this matter? Well, as an obesity doctor, I've seen the struggle people face in trying to lose weight. It's real and it's frustrating. That's why I feel obligated to share the full picture about GLP-1 drugs. Yes, they can help you lose weight, but they come with risks that are often downplayed. And the truth is, there are natural alternatives that can mimic the same mechanisms that these drugs use without the severe side effects. Let's dig deeper. So what are the problems with GLP-1 drugs? Number one, the side effects. Here's some of the alarming list of side effects associated with GLP-1 drugs. Pancreatitis. That's when you have inflammation of the pancreas, which can be life-threatening. Thyroid cancer. Studies show a potential link between medullary thyroid cancer and this drug. Gastric paralysis. These drugs delay gastric emptying. I've even had patients coincidentally end up with a bowel obstruction shortly after starting these drugs. Muscle loss. Up to 50% of weight loss comes from muscle, not fat, which is dangerous for your long-term health. Mental health risk. There's an increased risk of suicidal thoughts and behaviors. Eye complications. Retinopathy and macular edema can occur, which can lead to negative effects on your vision or even vision loss. And other issues like nausea, vomiting, severe gastrointestinal discomfort, gallstones, and even kidney failure. And trust me, this is just a partial list. Number two, financial and practical concerns. Beyond the health risks, the financial costs are staggering. Many of you already know this, and even if your insurance covers it, the copay can still cost hundreds of dollars. So if your insurance decides they don't want to cover it, this could be a tremendous burden on your bank account. And number three, the weight loss isn't permanent. Studies show that 80% of people regain the weight after stopping the drug. I see this over and over again, and when people stop the drug, they tend to gain that weight back. Now let's talk about the mechanism of action. GLP-1 drugs mimic the hormone glucagon-like peptide 1. It works by reducing appetite by affecting the satiety centers in the brain. It slows gastric emptying, keeping you feeling full longer, and improves insulin sensitivity, helping you to regulate your blood sugar. Now that you know how it works and its potential side effects, wouldn't it be nice to have another way to get the benefits of these drugs without having to deal with the potential side effects or costs? What if I told you there are natural ways to achieve these same effects? Here are some natural alternatives with similar mechanisms of action. Number one, the ketogenic diet. Always start with what you put on your plate. The ketogenic diet is one of the most powerful tools for weight loss because it naturally mimics many effects of GLP-1 drugs. Keto suppresses your appetite. It does this by stabilizing blood sugar and promotes ketone production, which directly signals the brain to reduce hunger. Keto improves insulin sensitivity. By drastically lowering carbohydrate intake, keto helps your body use insulin more effectively, addressing the root cause of weight gain for many people. Keto preserves muscle. Unlike GLP-1 drugs, keto diet promotes fat loss while maintaining lean muscle mass. Number two, intermittent fasting. Fasting is another natural way to mimic GLP-1 effects. How? Fasting leads to appetite regulation. It does this by lowering ghrelin, the hunger hormone, while increasing satiety with hormones like leptin. Fasting also slows gastric emptying. Extended fasting can slow digestion, much like GLP-1 drugs, but without the risk of gastric paralysis. And improve metabolism. Fasting promotes autophagy, a cellular cleanup process that enhances metabolic health. Number three, of course I had to mention this, the carnivore diet. For those who prefer simplicity like me, The carnivore diet focuses on nutrient-dense animal foods, reduces inflammation, stabilizes blood sugar, and naturally suppresses appetite. Like a lion who only eats once or twice a week, carnivores simply don't need to eat as often, avoiding the grazing that many animals have to do on a plant-based diet. And as an FYI, the carnivore diet is particularly effective for people with mental illness, neurodegenerative diseases like Huntington's and Alzheimer's, and cancer. Number 4, exercise. While often overlooked, exercise, especially when doing strength training, provides profound benefits. It preserves muscle mass, and unlike GLP-1 drugs, which causes muscle loss, strength training builds and maintains lean muscle. Exercise also helps regulate blood sugar by enhancing your body's ability to use glucose, improving insulin sensitivity, and the more muscle you get from exercises, the higher your metabolic rate. Number 5, Satiety Per Calorie method, abbreviated SPC. I learned about this innovative method from Dr. Einfeld of the Diet Doctor website via his new website called hava.co. This is an innovative food-based approach similar to GLP-1 drugs with real food instead of pharmaceuticals. Using data from over 67,000 days of eating logged in the Hava app, SPC helps you eat fewer calories naturally by focusing on foods that are more satiating per calorie. The SPC method has shown a strong correlation between higher SPC scores and reduced calorie intake. By shifting to high SPC foods, users are eating nearly half as many calories as those consuming low SPC foods. This approach could yield weight loss and metabolic improvements similar to GLP-1 drugs, but without nausea, muscle loss, and financial strain. If you're interested in this innovative approach, I'll have a link in the video notes. Number 6, natural supplements. As a doctor with a master's in nutrition and functional medicine, I've learned that there are times when supplements add value. Although I always encourage my patients to choose diet over supplements, here are a few that have similar effects as GLP-1 drugs. Let's start with Berberine, a natural compound that improves insulin sensitivity and reduces blood sugar levels, often called nature's metformin. In fact, for my patients who don't tolerate metformin, this is the supplement I usually encourage them to try. Apple cider vinegar, which works by slowing gastric emptying and helping you to stabilize your blood sugars. Most of my patients take about a tablespoon a day, but if you do, make sure to dilute it in water since it's so acidic. Inositol, particularly effective for women with PCOS, inositol can regulate insulin and support healthy weight loss. Gymnema sylvestre, known as the sugar destroyer, this helps to reduce sugar cravings by blocking sugar receptors in the taste buds, much like GLP-1 drugs reduce appetite. It also helps improve insulin sensitivity and lowers blood sugars by increasing glucose intake in cells and reducing glucose absorption in the intestine. As a result, it supports appetite control, enhances insulin function, aiding in fat loss and blood sugar regulation, and it reduces overall calorie intake naturally. A suggested dose is 400 to 600 milligrams daily. And lastly, 5-hydroxytryptophan. 5-hydroxytryptophan is a precursor to serotonin, which plays a role in appetite regulation and satiety. By increasing serotonin levels, it helps suppress hunger, particularly cravings for carbohydrates, much like GLP-1 drugs work on satiety centers in the brain. It therefore leads to a reduction in appetite and emotional eating. It helps to regulate mood, which can positively influence eating behavior, and it may even improve sleep, which indirectly supports weight loss by reducing hunger hormones like ghrelin. It's usually recommended to take 50 to 100 milligrams before meals, but doses up to 300 milligrams are used under guidance. All of these supplements offer mechanisms that align with the appetite suppression and insulin regulation effects of GLP-1 drugs, but with significantly fewer risk and side effects. They can be excellent additions to a natural weight loss plan when paired with dietary and lifestyle changes, but always remember, when adding supplements, only do one at a time. That way, before you add another, you'll be sure to know if your body can tolerate it. Here's another obvious one: sleep and stress management. Poor sleep and chronic stress disrupt hunger hormones and make weight loss harder. Prioritizing quality sleep and managing stress can have a similar appetite regulating effect as GLP-1 drugs. Here's the bottom line. These alternatives work because they address the root cause of weight gain, such as insulin resistance, inflammation, and hormone imbalances. GLP-1 drugs treat symptoms but fail to address these underlying issues. For example, keto and intermittent fasting restore metabolic health by lowering insulin levels and stabilizing blood sugars. Strength training builds muscle, which increases insulin sensitivity and burns fat more effectively. So here are my takeaways. Number one, you must understand that losing weight sometimes comes with struggle. Weight loss isn't easy, and it never has been. This video isn't about shaming anyone for using GLP-1 drugs. If you've tried everything and feel these medications are the last resort, I totally understand. But before you make that decision, consider the alternatives. As an obesity doctor, I'll walk with you no matter what choice you make. My goal is to give you options, empower you with knowledge, and help you make the best decision for your health. And with the new year around the corner, now is the perfect time to take charge of your health. So instead of risking the side effects of GLP-1 drugs, why not start with tools that are safer, more affordable, and sustainable? So if you found this video helpful, share this video with anyone who needs to hear this message. Together, we can create awareness and inspire others to take a natural, sustainable approach to weight loss. Let's make 2025 the year where we prioritize health over hype, and I'll see you in the next video.